what is the scope of MD dermatology, both in the form of income and free time? Now, this is one question which most of the students they ask me after getting a good rank in their exam. So I am Dr. Manish Soni, MD Dermatology, and I am teaching PG aspirants all over India for last 12 years now. And I think I am the best candidate to answer this question for all of you. So whenever a student get a good rank and when he's eligible for getting dermatology in the counseling, they fall into a dilemma that whether to take dermatology as a branch or they should opt for some other branches like radiology, medicine, orthopedics, etc. So what are the pros and the cons of dermatology? So let me discuss both of these, starting with the cons of dermatology. So first of all, there is a tough competition for jobs. So if we talk about the cons, the first cons is that there is tough competition for job. Why? Because of the increasing MD seats. So the MD seats of dermatology initially were very few, but gradually they are increasing and more private medical colleges are having more and more number of MD dermatology seats. And that's why whenever there is a vacancy, whether it is a government vacancy for a government job like senior residency or a specialist, then the number of applicants are more, and that is the reason why nowadays there is more tough competition for these seats. The second con is income. Now you will earn a good amount of money for your needs, but if you compare your income with the branches like radiology, orthopedics, or gynae, or for that matter general medicine, you will find that comparatively it is less in dermatology. Now, if you see the income of a specialist in a town and compare it with the specialist in a city, you will find that those who are practicing in a town have a better income. They are earning more in their private practice in comparison to the metro cities because there is more of competition. Then obviously the top practitioner of the town or a city definitely earns very well, and that is for valid for all the specialty. Wherever the practitioner is very famous and he earns more, and for that definitely you need a lot of hard work and good skills and also a bit of luck. So definitely that the top practitioner is going to far pass in the form of income. The third con is that you have to start early. Okay. Now, what that means? It means that whether you have decided to do your private practice of dermatology or whether you have decided to work for a medical college or a government job, you should always start early and not waste your time for, like, sometimes students they want to go for a fellowship or sometimes observership. And so what happens once you join a government job, what happens is that a seniority list is there and you are in higher in the seniority list. So that's why you get an edge that you will be promoted first, your increments will occur first, and your job will be for a longer tenure. So all these will be early. And definitely if you have a longer tenure, there will be more chances that you might get an administrative post in government jobs, like you can become the head of the department or maybe the principal or the dean of that college. So that is one thing that you should always start early. The fourth feature which I feel is chronicity of the skin conditions. Okay, so most of the skin conditions they are chronic in nature, and that's why sometimes it becomes very frustrating that even after your full effort these conditions relapse. Okay, so this is something which you might feel that relapses and recurrences are very common despite your full effort. So this might frustrate some of you. So coming to the pros or the good part, the first good part is that there are no emergencies in dermatology as such. But yes, there are few emergency conditions like Steven Johnson syndrome or 10. So sometimes these patients come in the emergency department. So if we exclude the PG part, that is the 3 years of your PG MD, that is when you have to do the emergency posting. But otherwise, if you don't want to deal with this and you're not working in a hospital setup and you have your own private practice, then generally these emergencies are not there. And that is something which is very important for your leisure, for your off time, that is when you are away from the clinics or when you are away from the OPDs, then you can actually switch off your phone and without feeling guilty about it, because this is not possible in other branches. So you will definitely get time off for yourself, and that time is your time, so you can spend it in your way or in any leisure activity. So this is something which I find that it is very good with this branch. The second thing is clinical skills. Now, clinical skills are very important in dermatology, and as you all know, that you have to make the diagnosis based on history, examination. You have to see the patient and diagnose these patient. And sometimes when you diagnose these conditions, which sometimes appear similar, but you diagnose these conditions and you know the differentiating features, and when you diagnose such rare condition, it gives you pleasure. So clinically, it is very satisfying branch. The third is procedural dermatology. So the good point is that dermatology is not just a core clinical branch, but along with that, there are few procedures which most of the dermatologists do, and these procedures can be in the form of chemical peeling or electrocautery, radio frequency ablation. It can be in the form of microderm abrasion, and there are so many procedures, laser procedures and all. So all these can be done by a dermatologist. So it gives you pleasure to do these procedural dermatology. So if you have a little bit of like surgical inclination, but you don't want to go in the pure surgery branch, then this will give you an edge and you can pursue those small procedures in dermatology. The fourth is hair transplant. Now, this is something which is very commonly being done, and initially only plastic surgeon used to do hair transplant, but most of the dermatologists are also doing very well in this branch. And if you have like inclination towards surgical skills, and if you like hair transplant, which is like a day long surgery, so if you want to do that, this is a possibility here. And if you are interested in this, you can pursue this as a full-time career. And this thing is not available in any other branch, that if you do a medicinal branch, MD branch, and then you want to do a surgical procedure, then that is not available in other branches. But this is a possibility here, that after taking dermatology, you can completely full-time become a hair transplant surgeon. Okay, so that is one good part about this branch. Then the fifth thing is that investment. Like there are certain branches which require huge amount of investment, which is a pro here, that you don't require a huge investment for a clinic. You generally need a basic premises and a basic equipments to start your private practice. So that is also a pro here. So to sum up all these points, I would say that if you have a good branch and you have inclination towards clinical branch, you want to choose a clinical branch, and you want free time in your life, that is free time for your family and for yourself, then you can choose dermatology as a branch. Though if you talk about the income part, then maybe you won't be earning massively, but yes, you will be fulfilling all your needs. And as you grow in your private practice, definitely your earnings will proportionately increase. So if you have a good rank, if you have clinical inclination, and you don't want to opt for radiology, because that is one of the most preferred branches of good rankers, so then you can definitely choose dermatology, and you will feel pride in choosing dermatology. And I am yet to find any dermatologist who regret taking dermatology as a branch. So I hope this was fruitful for all of you. Thank you very much. All the very best. And remember that once you take a branch, you marry that branch, because that branch stays with you lifelong. So take your time, talk to your parents, talk to yourself, make a decision, and whatever decision you take, I would suggest that that decision should be yours. So listen to everybody, but final decision should be yours, because you are going to marry this branch, and this branch is going to stay with you for your life. Okay, so this is a very crucial and important decision, and I hope you will be able to take this decision more fruitfully now. Thank you very much.